Hello, everyone, and welcome to our TRiiBE Tuesday panel. If you're new to TRiiBE Tuesday, this is our monthly panel series where we invite community leaders, public officials, and experts to join us to discuss current events in our community. I am Morgan Elise Johnson, co-founder of the TRiiBE, and I'm happy to be the moderator today. This month, we present to you TRiiBE Tuesday, COVID-19 Facts and Conspiracies, which is sponsored by the Fields Foundation of Illinois. So thank you so much, Field Foundation, for continuing to support us with this outreach initiative to bring these hard-hitting topics to our audience. As temperatures drop and we are forced to stay indoors, how can Chicagoans prepare to social distance during the winter? Should Black people trust COVID-19 tests and vaccines? What can public health officials and healthcare providers do to help restore the Black community's trust after decades of institutional harm? I want you all to tune in and bring your questions, okay, for this TRiiBE Tuesday COVID-19 Facts and Conspiracies. I have an esteemed panel with me today, medical professionals and just some good storytellers joining us to talk through some of these topics. First, I have Sista Simpson, who is a community epidemiologist for the Association of Clinical Trials Services and for the Department of Public Health. A public health practitioner for over 31 years with 21 years as an epidemiologist. She has presented, taught, and published at numerous community forums, professional work groups, conferences, and schools. She's currently working on a policy for violence as a disease. She has a Master's of Arts in Public Health, a BA from the University of Illinois, Chicago, a whole bunch of other accolades. Welcome, Sista Simpson.
Hey, can you all hear me? I was trying to get it right. It's a little dark, but you know, every time I move around, it's something different, and I don't want to keep messing it up. Thank you so much. I appreciate being here. And of course, Mr. Anthony Bryant used to be my intern, but now he's my colleague, and I am Sista Ya, your favorite community epidemiologist. And let me know, Morgan, how you want me to proceed. I've got a lot to share. I can answer some questions, and other questions I can speculate. But if you want data, I have an announcement I want you all to do as young people, and we'll go from there.
I mean, it seems like you are excited and ready for the conversation, and that's why we like you to come. I just want you to be yourself. We have a bunch of other panelists who are going to be joining us. I'm going to introduce them as well, and then we're going to jump in. Okay,
all right.
I want to bring in Simone Bryant, who is, hold on for a second, like I'm hearing a whole bunch of noise. Let's put her on mute. There we go. All right, so we have Simone Bryant, who is a Chicago native and family nurse practitioner. She is currently working with patients who require rehabilitation services from COVID. She has over 11 years of nursing experience and got her Master of Science in Nursing from Purdue. So welcome, Simone Bryant. Thank you so much for being here. Excited to get some real world experience for what it's like to be a nurse, dealing with COVID.
Yes. Thank you so much for inviting me. I am honored to be in the same room as Sista Ya. I appreciate your work in the community. And just as a nurse, to keep it short, as a healthcare provider now, to inform people on what's going on and to help treat the community is the best way I can do it. So thank you.
Great. So next, I'm very excited to have Dr. Elizabeth McNally, who is a doctor and researcher at Northwestern University's Feinberg School of Medicine. Since COVID-19 began, Dr. McNally has also been working with a team at Northwestern studying how COVID-19 is affecting and spreading in neighborhoods. The SCAN study, which is screening for coronavirus antibodies in neighborhoods, is recruiting participants to learn about whether they developed antibodies to COVID-19. Welcome, Dr. McNally. Thank you so much for being here.
Thank you. Thank you so much for having me. This is really a great group of people you put together, and I really look forward to hearing what people have to say.
Yeah, I'm really excited to have you here specifically because Northwestern reached out to us, the SCAN study reached out to us and saying like, hey, can you advertise this program? And initially my response was, actually, I don't know that my audience will take to this well right now because we, as a media outlet, have not done the work to inform our audience enough about COVID antibodies. And so we wanted to make sure that we have some type of information available before we even like advertise this program. And so I'm so happy that you all and your director said like, we want to be a part of the solution. We want to help build trust. Thank you so much for being here to answer our questions.
Yeah, happy to be here. Look forward to hearing the questions.
Great. Next, we have Angela Ford, who is the founder and executive director of the Obsidian Collection Archives, a national nonprofit organization focused on getting the images and articles of African American newspapers and small archives into the marketplace and on the internet. Miss Angie Ford, where are you?
I'm here. Thank you.
Hi.
Thanks for having me. Hi.
Okay, so I wanted to have you on because we have been having conversations about COVID, and I know you're also a great storyteller with a wealth of knowledge about, you know, history and personal experiences when it comes to like Black people in hospitals and why we have mistrust. So thank you so much for being here.
Thanks for having me.
And you're a COVID survivor. So
And I'm a COVID survivor.
Yeah, so I'm happy to learn more about that experience. We're going to get to that. All right. Last but certainly not least, we have, oh Lord, y'all, I didn't practice his name. We have Dr. Steed, who serves as the Sinai Health System's Executive Vice President and Chief Operating Officer. She's a highly accomplished and award-winning transformational healthcare executive with over 20 years of exceptional leadership skills and a proven track record of driving results and executing excellence. Okay. Dr. Steve, y'all.
So I'm very delighted to be among this esteemed panel, and most definitely talking about a subject matter that's very near and dear to my heart, and most definitely at the central nucleus of what Sinai Health System specifically is really driving fundamental change at today. So very excited to talk about this topic. Obviously, this is a minute by minute, day by day situation. So definitely interested in picking everyone's brain on the panel today.
All right, so let's go ahead and get this started. So we're gonna start with the basics. All right, so Dr. Steve, let's start with you. Can you just tell our audience, break it down in layman's terms, what is COVID-19 and where did it come from?
Sorry, I'm taking myself off of mute. So COVID-19 is a culmination of various viruses. It actually originated in late 2019 in Wuhan, China, and it's rapidly spread into a global pandemic from that point, all across the nations as we know it. So we've been bearing the brunt of this for the going on 9 months now. But essentially, it is a rapidly and highly infectious virus.
Great, thank you. And when this virus first broke out, there was a ton of conspiracy theories that hit the internet. And I'm just curious, what were some of the conspiracy theories that you all saw? And within the medical community, how do you combat that? Dealing with, you know, patients and trying to get information to the public and to the government. Dr. McNally, let's start with you.
Yeah, sure, I'll dive in. I think some of the biggest conspiracies have actually been spread by our president of the United States, who many people he routinely calls it the Wuhan virus, the China virus, as though an accusation that China somehow did this on purpose. And that is still a concept that exists a lot of places. So it most likely came from bats and bats in a cave. But there is a big laboratory in Wuhan where people do study these viruses, and people have accused that laboratory of engineering and making this virus in a test tube and then spreading it around the world to somehow advance China. It's not very likely that that's true because China was hit first by this, and they went to very extreme measures to try to keep it from spreading. And so it wasn't good for China, so it's hard to imagine why China would be the ones doing this.
And Simone, I'm wondering, as a nurse practitioner, dealing with people who have had COVID, what are the conversations like that you're having with patients? Are people in denial? I saw some stories with nurses dealing with people who are actually in denial while getting treated with COVID.
Yes, very much so. Some patients I've encountered say that it's just a cold, I'll get over it. But unfortunately, what I've seen is that they require more help. They require extensive rehab services post-infection. There are many patients who are still short of breath, who still have muscle weakness. So these symptoms are very debilitating. So I just try to encourage the patients that this is this is very much real, and you have to take care of yourself, and you have to work to, get stronger because they're so weak now. So it's not just a common cold, and so many people require so much help after getting infected.
So if you can see at the graphic, there are some differences in symptoms. And one way that it's been incredibly difficult to communicate as just like a member of the media, like what COVID is, it's been really, really difficult to nail down the symptoms of COVID. Why is this virus presenting itself in so many different ways? What are you all seeing in the medical community? Sister Ya, can you chime in here?
Yes, I was gonna pull up some data because we're not dealing with that. But as an epidemiologist, I got to start off with some data, baby. And it's not because it's into the numbers itself, but it's also because it gives you a clear understanding of the baseline, what you're dealing with. Unfortunately, I thought I was going to be able to have some slides, but can you hear me?
Okay, you're back now.
Oh, I'm sorry if I'm chiming in and out. I don't know. It's been doing that all day since I started. I don't know. But I tried to put this on a different. Can you still hear me? I'm just going to talk and if it go in and out.
Yeah. Hit us with the data. What you got?
So as I was referring back to the data, we really do want to talk about this. People talk about how many numbers, but realistically, you all are not listening to the numbers because it goes over your head. I mean, it's just really too much to wrap around. So they use other constructs like a positivity rate, the number of people tested versus countries that have it. And it's at 12.9. The reason you can grasp that is because it's more of a percentage. So what you're saying to yourself is like, well, we know that it's only about 12 now, but it used to be down to 5. And it was as high as, in some places there's high as 50. So you can gauge where Chicago is. But let me really, I wanted to show you all what they call a data board, but I won't be able to pull it up. But at any rate, the point of it is, I really want to talk to that 18 to 29-year-old because that's where some of this is coming from. They're asymptomatic, meaning you are right. Everybody does not exhibit the nine.
Okay, Sister Ya, you're breaking up for me. Is she breaking up for y'all?
What they call, there are about 9 different symptoms symptoms that are just alike. Let's go away. Some people have headaches.
We're going to hold on and pause on you, Sista, because you're breaking up. I need you to turn off maybe your other devices, turn off your phone, turn off your computer, whatever it could be sucking up your Wi-Fi, and then we're going to come back to you, okay? Somebody else, Dr. Steed, can you tell us about some of these symptoms that we're seeing, why it's hard to kind of like nail down how COVID-19 is presenting itself in people?
Sure. So in short, the coronavirus is showing up in many shapes, forms, and sizes. And in the early stages of this, we most definitely parallel more closely to that of the flu, because flu-like symptoms was specifically a cough, respiratory type of infection, as well as a fever was the most common presentation. But as we evolved with this and certainly learned more as the months have gone on, COVID is showing itself up through multiple forms, including the common cold and respiratory symptoms, is also showing up through a loss of taste and smell. It's showing up through body aches and pains. And then as we learn more, specifically in the Black and Brown communities, COVID-19 has been wrapping around underlying conditions. So it's actually been showing up more specifically and aggravating those underlying conditions. So if you suffer from hypertension, if you suffer from diabetes, if you suffer from mental health issues, it's compounding those underlying conditions. So it's not just in its beginning presentation. And as healthcare providers, we're often off-put by how it initially presents itself. And it's specifically in across the hospitals that I oversee, we instituted temperature checks at the point of entry into our organization. And we really gauge screening tools for those initial signs, like the cough, like the body aches, like the fever above a certain level. But what we're learning is you have to look beyond that initial presentation, because it shows up in all shapes and sizes.
Mm-hmm. Okay, Angela, like, you had COVID-19. What were some of the symptoms that you experienced?
Immediately, my son and I live in the same building, and he lived downstairs, and he said, "Hey, do we have any Theraflu?" He shot me a text. So I ran downstairs like a mother, and we both knew we had a problem. It was violent cough and an intense amount of pain. I mean, the pain was, I've given birth, and this was pretty detrimental. And it was very early in March, so there was no information in the marketplace, just kind of wash your hands. And it was exhausting, because we were on the internet seeking information, and so that was all they could tell you was, hey, you got to wash your hands. But there was no information for, oh, so you have it, so here's what you should be doing. And what happened for us is, I've got, a few friends. We're not young, but some of them live kind of free spirit, off the grid. And it was some of the natural medicine, the herbalists that are out there in the marketplace. People just started circulating videos. And so we started doing some of the homeopathy or naturopathy, whatever the modern terms are, that really did save our lives. I have sarcoidosis, so I just couldn't afford another lung situation, and it was pretty bad. So my son recouped first. He's younger. He was 30, and I came along maybe a few days, maybe 4 days later in terms of recovery. But March was bad month for us.
And I want to go further into that a little bit later. But Sister Ya, glad to have you back. Sister Ya is not fully back.
Not back.
Okay, I'm back. I was hoping I put it on mute because I'm unplugging my mic, and oh well, it is what it is. I'm actually still in the office, and so sometimes I guess we just don't get good internet. But I don't want to say that. Realistically, what I really want to push right now is I think the people for really talking about it. In Chicago, the first person to die from COVID-19 was actually a Black woman, and she did have asthma. And not just her sister died as well. So they was hospitalized, but unfortunately, the first lady was actually already had been in the hospital. So that goes to show you that this thing was actually spreading unbeknownst to many of us in the healthcare field. It was already spreading in hospitals. It was already spreading in places that we had not considered. So one of the things that I'm able to do is I can't get every detail about where people are testing and what. You really do have to go online. But what I just wanted to do was let people know that of all these 150,000 cases, young people are about 23% of the cases. And we really want to stress out young people. But unfortunately, I'm also happy to say that Black and Latinos are actually like about 36% for Latinos and 18% for Blacks and about 17% for whites that are impacted by this. But I want you all to, and I already list this, I sent my slides, so please give this to your people. This is something that we want the young people to do. COVID-19 Young Adults Survey. You can go, just, Google, go to it's right there, the link. Make sure you go, because this is why. Of all of our information that we have about COVID and the different, demographics, the least amount of information we have is for young Black and Latino people, but mostly young Black people. They do not have enough information. So this survey is to make up for it. That's what we call doing a sample size, and that's what we want to give. So I actually contacted Anthony about this for you all to help us to push this out. And this is the reason why. Guess what, you all? Black young people are getting this virus. And even whether they know it or not, COVID-19, they're getting it, but some of them don't feel it. So when you say asymptomatic, what we mean is they don't feel like they have a cold. Some people go through different iterations depending on their body. And we need to talk about your body, because your immune system is what dictates how bad this gets. The more your immune system can fight off the virus, or what we call COVID-19, the coronavirus, the more it can fight it off, the better you can do. The less that it can fight it off, the worse you get. And that's when you hear like the 20-year-old who died in her room because she probably, may have had an underlying health condition and didn't know it, or knew it and nobody helped her. So I'm really asking you all, we'll talk a little bit more about the survey if people want to contact me, but I just want to get that in because I want my panel members to really delve into what are you getting at when you say there are, conspiracies. The first thing is the vaccine. The second thing is treatment. And we are not dealing with treatment the right way, honey, not at all. And I'll be the first one, if I'm the only one on this panel, who will say treatment should have been the first thing out. In every disease we've ever worked with, treatment has always been A-B, test, treat. Now we're like test, vaccine, maybe treat. We need to have a conversation.
Okay, so I want to bring it back to like some more COVID conspiracies about how this got here. Let's put this mute button. All right, so about how this got here. One conspiracy that really took off was about 5G. 5G technology brought this virus here. There are cell towers everywhere. This is actually a 5G availability map. People will take information like this. They will say, look at all these 5G towers. Talk about kind of like radioactive activities versus viruses, because there are, the thing about conspiracy is that there's always like a little stem of truth usually that people can grasp onto, and then they kind of take on a life of their own. Dr. McNally, can you talk a little bit about like the differences between a virus versus like, you know, a disease that you can get from ultraviolet rays or other types of radioactivity?
Yeah, so a virus is actually a really simple thing. A virus is a little bit of what we call like a DNA or RNA, like our genes. Only it's got its own genes and a really tiny number, and then it's surrounded by a little bit of protein. So it's a biological thing. That's why, because it's just made of that, that's why you can destroy it with things like soap and water and things along those lines. They don't stand up to soap and water even. That's why that works, or alcohol wipes or alcohol rubs. It has nothing to do with things like radio waves, which is what 5G is. We know very well where the virus came from because that little DNA sequence, it's actually RNA sequence that it has in it. We can sequence that and we can follow where the virus went and where it came from. And Chicago is actually really interesting because back in the spring when it first came, we know that a strain of it came from China because it matched the same strains that they had in China. We also know a big bunch of the virus here in Chicago came from Europe, came from Italy, because it actually matched the version we found in Italy. And then when there was a third version that popped up that was unique all to Chicago all its own. And they're like families of the virus. That Chicago specific version seems to have sort of dwindled and gone away. And what we ended up with was a mix of influx that came from China and came from Europe. And probably the most likely way it got here is the way that things get from China and get from Europe, which is it comes on airplanes and it lands at airports, and then people spread it. And they spread it because they didn't know they had it, which gets to what we were talking about before. There are lots of people who have almost no symptoms, especially young people can have this and have no symptoms at all, except maybe feel like their taste was off for a day or their smell was off for a day. That might be the only symptom, but those young people can still spread it. And especially in the households, we know is where it spreads. So it can spread real easy to older people in the household who then get it and can get really sick from it. So it's because it's a virus which has its own biology.
So it's kind of like it's a living organism. Okay, so
yep.
The thing I think that was really confusing for people in terms of messaging was this idea that the virus was airborne. So this idea that the virus is just like in the air, but can you clarify, like the virus, it needs to attach itself to something, correct?
Yeah, so the way it actually spreads, the best we understand right now, is it actually spreads on little droplets because it is pretty sensitive. Like I said, you can wipe it out with soap and water and alcohol wipes and things like that. But what happens is it actually just spreads. When people talk, everybody knows when you talk a little bit, especially if you're eating and talking at the same time, we all spit a little bit when that happens. And it turns out it's that little bit of spit that comes out that we can't even see, but that's actually what it travels on. So we now know the biggest spread of this actually happens when people sit down and have a meal with each other. We talk, we laugh, we joke. In churches and choirs, when people were singing, when you sing, you have those big, deep breaths, and that's coming down from the lungs, and little bits of spit come out. And that's actually how it was spreading. There was some really remarkable cases of it spreading in choirs when people were singing. And so that's been very hard because we all love music and we love to talk and tell stories and share meals. And sadly, that's how this actually spreads.
So to avoid any doubt for people who are just like, nope, this came from 5G. Now we have another map, like a map of India and 5G activity in India. Can y'all pull that up? Now, India, there is no 5G towers, okay, in that large map of land in India. But we know that under the US, India has the highest number of cases. So you all, it's about this living organism acting as a host, spreading amongst the population, okay? It's not related to 5G. And the idea of airborne, things coming out of people's mouth, it was hilarious to me that people acted like that's not possible. I'm like, have y'all ever got hit in the face with somebody's like bad breath? I know y'all know things can come out of people's mouths and reach you, okay? So that is how the coronavirus is spreading among us. So we definitely have to be careful about that. All right. So
Morgan, can
yeah,
you hear me?
yeah.
I like to comment on that a little bit, and I am going to give some pushback a little bit to my colleagues about how this virus is spread.
Go ahead.
It is very virulent. It is between Ebola and like the measles. Now, Ebola is completely airborne, whether you think so or not. It is very much in the air. It has a heavier weight and it does move. When she's talking about particles, measles is extremely infectious, and you can leave a room and still get measles because it's airborne. It's in the air. There is some research that is coming out that's trying to weigh how much this virus is, because it tells you how the cartilage can still be in the air. The word we're using, or we're told to use, is called aerosol. But at the base of aerosol is what? A mist in the what? Air. So just like if I sprayed, you all seen disinfectants, you see aerosol, right? You know,
Yeah.
your Lysol is aerosol. If you can see the trajectory of that, is a good idea of how this particular virus more than likely is spreading. The virulent nature of it, because of the mist of it, it goes out further. So the doctor is right. When you sing out, it does go out further. What the nuance is, though, we got to really deal with this, you all. Most lay people don't care about a mist versus a droplet. It's in the air. It is therefore, this is airborne because it can stay in the air, but we don't know for how long. It hasn't been shown that it can stay there for hours. That's why they're telling you to social distance, because then the droplets, if you wear your mask, is less likely. This is called a harm reduction approach. Not 100%, but less likely to get into your nose, your mouth. I question the eyes, but any orifice in the face. So we do want to be, I'm going to push back, and I'm telling people, no, for your benefit, if I tell you this is airborne, would that change your behavior? It probably should, because it's more airborne than it's less just, it's not just one little droplet, it is aerosol, but that is airborne. So if you walk into a midst of a crowd of people, 50 or more, and all these people are talking, that's airborne.
Okay. Yeah. I think what we were trying to get to with the messaging is that, is it airborne and just in the air when people are not around, or is there like a host and the person is spraying the particles out?
Problem is multiple people, and that's what we have to. We are not dealing with the testing. If you knew who had it, you can stop. Well, the idea is if you know who has it, you can quarantine them from keep from spreading it. But we don't always know in a timely fashion. So testing should be pivotal. And in Chicago, actually, their testing is like far the best almost in the country. New York is probably doing a little bit better on testing, but they had a lot more time to deal with it. But Chicago is testing fanatic. However, the results aren't getting back the same day. So it's hard to catch up with 100,000 people, I'm kidding, 10,000 people and give them results. We're really fighting that part of it. But we must test, we must treat, because if a person is treated and can't spread it, then you also stop the spread. And I'm going to leave it at that, because I am not so eager about a vaccine that's probably going to take into next year before any of us, well, some of us, healthcare. But other than that, if you're not a healthcare worker or somebody on the front line, you're not going to see that vaccine until next year. Period.
So just piggybacking off of the topic of testing, I think that's one of the early lessons learned, that a lot of those on the front lines of this on the healthcare front is actually grappling with and learning from. A lot of the original messages that went out specifically wanted or were pushing individuals to really shelter at home and essentially prevent at all costs, even if you were ill, to quarantine at home and actually prevent from going to healthcare organizations. I think that was an early lesson learned, that we had to quickly navigate through and really be quick on our toes to be nimble. So and which caused a complete blanket of increased testing, which really started to put a brunt and an overload in laboratories across the country. So I think that was an early misstep in this entire process.
Okay, so why is the U.S. so far behind when it comes to containing this virus? We have more cases than any country in the world. Why is that? Dr. McNally, please.
I think, well, I'm going to talk now as a citizen of this country. I'm very disappointed how our federal government responded to this. I've just always considered public health as one of the things that I expect. I expect as an American, I expect that we have good public health. I can't tell you the level of disappointment I felt when this virus was hitting our shores and we did not have testing set up. That's just, they had 2 months to prepare for it. There's absolutely no reason why testing couldn't be set up and available to everybody. And you can have this in a letter. The second part is we've had leadership that turned mask wearing into a political statement, which is just makes no sense to me at all. We know it works. I mean, we're talking right now about vaccines coming out that are 90% effective. Guess what else is 90% effective? Wearing a paper surgical mask. Those should have been made available to everybody. And everybody should have been told early on, this works, and this is what keeps it from spreading as widely as it has right now. So those are just 2 really simple steps that we were fully capable of. And instead we turned into 50 different states, all competing with each other, trying to get resources, trying to get PPE. When they look back at this in history, they will just say that was a huge disaster because of the lack of leadership.
I'd like to add another perspective on that because I wasn't that surprised. My son, who I will mention in every sentence here because we got COVID together, he lived in China for a few years. He lived in South Korea. He lived in Bangkok. So I had the luxury of watching a young man in universal healthcare environments. And he actually was hospitalized in Thailand for 8 days. And the whole bill was $317. Now, I thought, how did you go get sick in Thailand? We don't have that kind of money. And he said, I am not in America. That's not how any of this works. And the same thing, he lived in China years ago through the Obama years. But anything, nothing costs more than $10 in terms of healthcare. So for me, I felt that, oh, this is the first of our lifetimes global test where everyone, the entire globe took the same test. Everyone got COVID. And then the American healthcare capitalistic system just failed. It failed. And then the leader was complaining that I didn't know the test was today. I don't have the answers for the test. China cheated. I mean, it was an equalizing situation. And I know you'll probably get to it later, Morgan, but we made a decision together because my son said, well, should we go to the hospital? Because we were gravely ill. And I said, no, we can't go to the hospital because I am not insured, as I've been self-employed for a collective 30 years. My son is insured through his job. He lives, back in the States now, obviously. But I said, they will separate us and they will kill me. And I said that long before the numbers for Chicago came out. But as a fully formed adult, I've been insured in the workplace and I've been uninsured as a self-employed individual. And I promise you, it's a tale of 2 cities. The way our systems work, I would never receive an aspirin because who's going to pay the $378 for that aspirin? Well, probably not her. So we'll just leave her here and come back and deal with her later. So I think when the numbers came out about Chicago and the hospitalization and the death, I was sad for my community because as Morgan introduced me, I'm a historian I know about Providence Hospital being the first Black hospital, open heart surgery, only hospital in the country where Black doctors could do their residency. And I know what we used to do when we took care of ourselves. But in a system that doesn't really care for anybody except those who have money, you know, if you're the president, you can pay no taxes and go to Walter Reed and get the secret vaccine and you'll be better. But the rest of us, it's the capitalistic society that was just pressure tested and failed.
Can I tag on to that?
Please.
So, and I'm speaking from one lens, and I can honestly tell you, even before COVID reared its ugly head, we are extremely proud to be on the forefront of leading the most vulnerable and underserved cities in our communities in Chicago. So I lead up Sinai Health System, which is the largest safety net healthcare provider in the city of Chicago. So disproportionately, the numbers are extremely startling. So as the various statistics start to come out at the state and city levels, just to put it in perspective, our mortality rates were 4 to 5 times greater than that of the state and the city. Speaking specifically from a disparity point of view, and we pride ourselves at Sinai Health System to really eradicate healthcare disparities, and that's where we're losing it. And in this process, we're singly looking at this in an isolated way and not treating this as a holistic solution. And we really have to look at the underpinning behind this. Well, so instead of treating the disease process in and of itself, which is COVID, we need to start to look at what are those underlying conditions that the Black and brown communities and the underserved communities and the vulnerable communities are really suffering through, and come up with permanent solutions to those problems. And it goes well beyond just the 4 walls of a hospital.
Okay,
and it's above and beyond the disease process as well.
Yeah, so let me jump in too, because I think that sometimes, because I'm by no means poor, and a lot of times Black and brown and medical care is stated synonymous with poor, which is exhausting. Do I have $20,000 for an ambulance ride? No. Am I destitute? No. And those kind of equations, we don't have, our healthcare system just doesn't mathematically work for middle class or upper middle class. You have to be, wealthy or in a job insured program. But to your point about looking at it holistically, it's as a storyteller. What I think Morgan invited me to the panel for is I told her while I was laying there gasping for breath, I remembered my great grandmother lived to be 100. All of my elders have passed on from old age, but they knew how viruses worked, and I was craving pot liquor. I knew that if I had some pot liquor, I would feel better than I did. What I didn't realize was how few people in the Black community know what pot liquor is anymore, which means we lost a lot of our basics. I think that the way the conversation happens in America, the Black and brown as deficient and less healthy is baked into the cake. It's baked into the cake from 1619, and it's baked into the cake now. Whereas even when Melissa Gates said, if there's a vaccine, we should give it to Africa. Good Lord, they're not going to survive. When in fact, the entire continent of Africa, 47 countries, only has 45,000 deaths. The entire continent, which means there's something about Black people doing something right at some juncture without all of this wonderful, blessed Western statistics and research and solutions. So as a historian and storyteller, I'm interested in what are they doing over there? Because I think a lot of it's got to be in the fact that our American diet has failed to protect our immune systems. We don't have the fresh produce, but there's a lot of other things to look at besides Black, brown, poverty, less than, need help, savior. You know, when I was sick, I was devastated because that's all I was getting in the marketplace was, hey, you need to wash your hands. And you know who doesn't wash their hands? Black people. You know what you need to do? You need to stop breathing on people. You know who breathes on people? Black people. It was like, excuse me, I'm fighting for my life. If you can give me some action steps to live, that would be helpful. And that only people that did it was Ted Nugent and some other off the grid Jamaicans gave us some real solutions to where we started healing, and we just got our bodies strong enough to survive COVID. I'm not disputing the science. I don't believe any of the nonsense. I wear a mask, but I think we can talk about some holistic action steps instead of from a place of victimhood and poverty.
Yeah, and don't discount my words in terms of I'm certainly not pointing in the direction of poverty. I'm pointing in a direction of just communities as a whole, and we need to look beyond just what's conspicuous. And certainly there's underlying situations, healthcare and non-healthcare, that really cause an accelerated effect of this, is what I'm saying. So we need to treat the community, not just treat the disease in and of itself. And we need to start to really pick at the distrust in the system. So this has really shed a bright light on the level of distrust that exists in our healthcare communities. So COVID, whatever the next situation is, our communities are not seeking the level of care that they should, and we need to start to work at that.
I have to jump in. I know Morgan, she probably's like, oh my God, I don't get to say anything, but Morgan, allow me just a little bit, the words that I'm going to say, and I appreciate Ms. Ford's directness, because she's absolutely right. Some of us got jobs, honey. Some of us even have insurance, scary enough, right? And we still die. It's not the job, it's not insurance, it is what? Racism, ladies. It's racism, the underpinning problem of our health, so-called care, because we talk about health, but it certainly isn't care. It is just a modality to just keep you surviving. This isn't really holistic. It's not cure. It's care. It's treatment. We're not getting what we need because our skins are black. I wrote an article for the Black Star Journal, if you ever get a chance to Google it or bring it up, and it talks about the two pandemics, but the first one started with racism. That's been the most incredulous type of pandemic on this planet, darn sure in this country. And we suffer from that more than we suffer from all these infections alike. And let me just put the focus back on the infection, because I know Morgan's like, we want to deal with that, but let's talk about H1N1, H1N5. I was around here at the health department when that broke out. They got, they did their thing with the vaccines and all of that and the treatments. But the point that I'm making is that was another level to show you this country moves when it wants to move, it does what it wants to do, and we have to think about if it's not in the best interest of the capitalist society, it doesn't move as fast. So we've had examples of they call that an epidemic, H1N1, but technically it's been around the world as a pandemic. But my point is racism is what we're dealing with, ladies, and we're gonna have to peel that back because our system of health, so-called care, I have to do that in quotes, air quotes, is not health care. This is just health treatment, just enough to keep you going, to stay sick, stay on those pharmaceutical drugs, and then die later because they made your profit.
Sister, I want to disagree with you, but I think it's more of an American problem. The American healthcare system is failing everybody. And of course, anything that happens, if it's failing white, if white people get sick, then black people get pneumonia. That's an old adage, and that's true. But the numbers, the American healthcare system is not designed for this. We've got, if we want to talk about equality, then we got to talk about universal healthcare. Everybody, once you take the money and the middle managers out of it, then you can actually start healing humans instead of, but I agree with you. I mean, who's going to say there's no racism in America? That's crazy. So of course it's racism in America. I agree with you on that. But if we're going to, COVID is an American failure across the board. It's except unless you're the president and the president's family, then you get the secret winning vaccine. But I mean, after that, everybody can take a hit in terms of COVID.
Okay, I wanna bring us back. There's a lot of conspiracy that deals with the idea that the medical community, the industry of medicine, wins when something like a global pandemic happens. Can somebody speak to the money side, the money and management side of what happens in hospitals when something like a global pandemic at this scale breaks out?
So I can certainly speak to the economics of this, and I think that the economics on this has played unfavorably, most certainly. So when there was no level of preparation for this. So I often equate this to truly building the plane and flying it at the same time at a rocket ship like pace. So this floated day by day, minute by minute, hour by hour in terms of how we had to block and tackle. This most definitely has impacted, and we're certainly still living through this. Most hospitals are not performing at pre-COVID volume levels, which has certainly devastated the economic impact on this. Given stay-at-home orders and the just global messages that went out, which is all for the right reasons, obviously, to prevent the further spread, it has prevented access to healthcare in the same ways that patients have accessed in the prior world, which most definitely has impacted in an unfavorable way. So most healthcare organizations in the early peak were primarily maintaining just a COVID hospital, and they didn't afford the same level of high quality, high acuity services that in the before state. So many of us had to stop elective procedures of surgeries, which most definitely impacts the margin of a healthcare organization, and had to block and tackle, given the fact that this shows up differently in terms of longer lengths of stay. The people, caregivers on the front line who are working through this were getting infected and really impacted. So just a global shortage of frontline healthcare workers, which most definitely has strained on the bottom line of healthcare organizations. So I most definitely don't see the economic benefit, and most definitely the government has had to step in and infuse various dollars in recovery funds, which has balanced in some way, but not necessarily to favorable, because it's impacted the bottom line of healthcare organizations.
I think some of the financial
Hold on,
impact.
Angela. I wanna get Simone in here to talk about, like, in terms of your work as a nurse, the amount of hours that you have going in. Did you feel prepared? Did you have the PPE? Like, are you working extra hours? What's going on as a nurse? Hold on, you're muted. Let me get you. There you go. Go ahead.
For the most part, we weren't prepared. There were a lot of issues that we didn't understand as far as how to get access to personal protective equipment. Of course, every facility has items on stock, but you're telling me, of course, you can't reuse your gowns, you can't reuse your gloves. You need to have the same masks, during the day. Certain things you're supposed to change in between patient care. So if you don't have enough supplies, how can you properly care for individuals? So that's just certain things we needed that we didn't have. And especially working in a hospital or long-term care setting, you need your supplies to help properly take care of people. You know, they were bidding wars for Illinois, you know, for masks and things like that. I think, you know, our governor had to up a lot of money to help get PPE to Illinois. So it was very serious. It was a bidding war between New York, several states. So if you can't protect the healthcare workers, how can we protect the people?
Mm. And has methods changed? Like, have things gotten better since we've been in this pandemic? Dr. McNally, like, have you all gotten more efficient with treating people?
I want to echo some of what we heard already today. I mean, I 100% agree that why it's so bad here in the United States is a total condemnation of our healthcare system and the way it's paid for in this country. There's no question about that. It's a struggle right now because, as we just heard, hospitals stay afloat because they filled their beds with surgical patients, and surgical patients go to the ICU to get care after they have their operation. And if all your ICU beds are full of people with COVID, you can't do operations. So that's what we saw happen from March, April, May. In June, we started to see we were able to go back to doing activities again. And now just the last few weeks, we've had to cut back on doing operations again on people who need surgery, in a situation where the hospital beds are full of people who are really sick and require so much care. And yes, we've gotten a little bit better at doing that. We've learned a few things medically that do make a difference. One of the things that makes the biggest difference right now is just a good dose of steroids right at the right time, early on. Steroids, which cost pennies a dose to use, not the $1 million of antibody that Donald Trump got, but literally something that just takes pennies. You give people the right dose of steroids at the right time, and this really does slow down that over rambunctious immune system that we see as part of this disease. So we have learned a lot. We've even got better at taking care of the people in the ICU. But the reality is if you're so sick and you can't breathe like that, and you have to be on a ventilator, that's a long haul. That's a long haul before you're going to get better from that. Hopefully you're going to get better. You're going to then need rehab afterwards. You're going to need all sorts of help to get back on your feet. This is a really devastating illness. I know people are very focused on, how many people died, but that's just the tip of the iceberg. There's all the people who got really sick from this and who are now dealing with the fact they were sick from it and taking months and months and months to get better. So it's a real strain on our system.
Yes.
Morgan, I want to just insert here. So I love what we're hearing. So you're hearing three different sections. One is the hospital system. We call that our medical system. We got public health system, which is supposed to, be much more into testing and preventive. That's what public health is better at, not treating. And then we have what we haven't talked about, ladies, our pharmaceutical companies. So reason that you're talking about the money is because the healthcare system, the public health system, and the medical system are all in a negative. But the positive is in the pharmaceuticals. Moderna, as well as Pfizer and a few others, are actually getting contracts from the government. So someone who said that is correct, but they're also generating funds from their private donors to come up with for vaccines. You know why? Because there's so much money in it. You mentioned the doctor from Northwestern, Dr. Neely, mentioned the antibiotics. Well, antibiotics actually are not profitable anymore. So they're not really doing a lot around it with the R&D because it's not yielding the kind of money. In fact, pharmaceutical companies have gone out of business if they're only doing antibodies. But if you jumped into COVID, or if you jumped into what we call vaccines between HIV, this, hepatitis, all those vaccines that were coming out, then that's where you made the most money. Pfizer is actually one of them. So it's so many sides to this elephant that sometimes we don't know if we're at the trunk or the tail. But the bottom line is not everybody is not making money. Pharmaceutical companies are profiting, making money both from the government and from private sources. That they're not telling you all their profit margin that's happened even before the vaccine, just to produce it. And this you can follow. I actually there's a hepatitis C pharmaceutical company. I can't think their name right now, They produced vaccines for hepatitis C. They actually got over $1 million from the federal government just to try to produce a vaccine for COVID. And for what? Testing. That was where they made their most money, off of better testing. They're trying to come up with a 20-minute test. It hasn't happened. I'm just telling you, I was able to read what they worked on. The bottom line was they made more money.
So I want to ask, like, since our medical system here is so capitalistic, how can Black people trust the vaccine that has been announced? Are we right to be a little bit cautious about taking it and being a part of tests and trials related to the vaccine? Dr. McNally, you are doing an antibodies test study. Can you tell us about that and why you are looking for people of different demographics to participate?
Yeah, we started a study. We actually got it going in June, and it was to ask people to test themselves whether you had antibody present to the virus. Remember, we said there's a lot of people who don't have much in the way of symptoms, especially young people. And so one way you can tell if you previously had COVID is your body will make an immune response, which we measure as antibodies. And so we set up a little test where you register online, we mail a little kit to your house, you do a little finger prick and give us a spot of blood, mail it back to us, and then through a website, we'll let you know whether you have antibodies or not. And we set out in June, we picked 10 zip codes across Chicago, and we picked 5 pairs of zip codes, 2 zip codes right next to each other where the case rates of COVID were very different from each other. That's how we picked them. And we're just getting the data in now. We've done probably thousands and thousands of tests and looked at probably the first 2,000 or so at this point. And the answer is, it looks like it was everywhere. So even though the case rates were very different in these different zip codes, the number of people that we saw that had antibodies was actually pretty similar across all the zip codes. So we saw a pretty big wave of this that came across us in the spring. Now, sadly, we're having another wave of it right now. So we're going to try to retest people starting in January and February and March to capture what just happened in this big wave now and see if it changes very much. But the answer is this thing spread everywhere. It spread in all our neighborhoods.
Why is it important for us to do these types of studies and these types of tests? Because there's a lot of people that are just like,
yeah. I think it's really important for everybody to try to participate where they can, provided it's a study where there's been safety. So the way studies work is we have what's called review boards that look at the safety for participation. A study like I just described is all it is a finger stick. Nobody's giving you any medicine. There's no issues like that. The vaccine trials are going on right now. There's been several sites in Chicago that have been recruiting and trying to get people. The whole goal of those vaccine studies is to try to get a representative population so that in the event the vaccine, say for example, it doesn't do well in older people, like we have enough older people in the study that we can start to detect that. That's what we're trying to look at with those types of studies. I think the big issue is going to be when the vaccines do roll out. We are going to see some come in the later part of December and again, more broadly in the population through the first half of 2021. And I think it is going to be tough. I mean, I have to say, I'm a healthcare provider and I have my own hesitation about like, how safe is this? What do we really know about how safe it is? We know the immune system's kind of crazy in COVID. Well, we're messing with the immune system. So I'm very, very much hoping that all of the data from these trials will be made public. That's what I want to see. I want to see all the data made as public as they can make it. Tell me how many people who were older got this, how many Black people got this, how many Asian people got this, so that we can see whether the virus actually, or the vaccine actually works better or works as well across groups. That's what we have to understand. These trials are pretty big. I mean, they have hundreds of thousands of people in them, probably if you add them all together. Hopefully we'll have a good enough sample. I also think I want to see people do studies after the vaccine comes out so that we can see how well it's lasting. The tricky thing about coronaviruses is often the immunity doesn't last. And we're seeing second cases of it right now, people who had COVID in the spring getting it again. So I think that's something we're going to have to really stay on top of. And so I would say that to help protect your community, that's part of why you want to participate if you can, because that's how we can know how well these things work in different groups of people, is by participation.
Dr. Steed, can the government or can hospitals or whatever, can they force people to get a vaccine?
No, this is still very much free will. So we can't force or mandate patients to get the vaccine. But as healthcare providers, we do mandate vaccines such as the flu in frontline healthcare workers. So we can very much mandate the frontline employees on the healthcare front to actually get the virus. I think that the huge elephant in the room as it relates to whether to get vaccinated or not is really dealing with the root of the matter. I think the root of the matter is the distrust that the various communities have, not necessarily in the effectiveness of vaccines, and even whether or not enough trials have been conducted. Is more so a deeply rooted distrust in the system as a whole, and it's most definitely reared its ugly head on the wake of these healthcare disparities that are rather prevalent. So I think that in order to solve for that I think that we're going to have to put words to action and actually get out there into the community at large to really understand the root causes of some of that mistrust and start to break away that mistrust in the overall system. And I think that we've seen several examples, right, wrong, the good, bad, the ugly, in terms of community leaders with a minority face that have stepped forward and volunteered themselves to participate in trials, just to set the example and really set the tone for others to follow, and that we can trust the system. I think that we're in certain communities, they're actually paralleling the COVID vaccination to being guinea pigs, just like the Tuskegee experiment, and things of that nature, as a key example on why individuals don't seek out and want to jump first with this. So they actually want to see it properly demonstrated with a positive outcome. But what I would say to that is the alternative is our community is going to continue to suffer if we don't seek out the treatment sources that are coming available.
Angela, I want to go a little bit deeper. Hold on, I'm going to go to Angela, then I'll go to you, Sister. Yeah. Remind us of some of the harms of the medical system on Black people, and let us know if you would trust a vaccine that comes out.
So the Tuskegee experiment is a huge thing. The experiment where they actually injected Black men with syphilis to do some experimenting and see what the effects would be. And so a lot of our elders, most who are over 70, it's just a hard pass. You won't find a Black man you will find very few Black men over 75 that will go into a white medical institution. That's just a hard no. But also, and so I'm not as distrusting, as much as I don't feel the way the system is set up, I'd be first anyway. I don't have to worry about that. I'm not insured. That I'm not even counted. So by the time they sort it all out, I would be able to pick from the most successful one. I think they got 3 hitting the marketplace now. So I keep abreast of things like that. And most of us, I've lived most of my life with entrepreneurs that are uninsured. We have holistic and naturopathic ways of surviving that are more in line with elder traditions before we were welcomed into these hospitals anyway. So there's an undercurrent. And I get all the statistics, but most of the time, and some of the conversation here has reflected that, is that the Black community is blamed for not being successful in the white institution. It's like, you know what? Let's just call it my fault. Let's just say that my diet is off. All of these tropes that I think it's time for us to look at some successful models. Like, again, like I said, Africa, you know, they're doing something right over there. And I'm more interested in some of the holistic solutions, but I would take the vaccine. By the time they swung around and gave it to everybody else first, I don't expect to get it first, because I'm like James Baldwin. I'm almost 60. You know, I don't expect this to be right. It's kind of baked into the cake.
So what are some things that people can do to protect themselves? Like, we know the vaccine is coming, but, you know, it's getting cold. There are people, we just got a question saying, many Black and brown people don't have the privilege of living in a space that has multiple rooms and rooms where people can separate themselves. Like, what can people do to protect themselves as we are going into the winter months, where we expect that this virus is really going to continue to spread at rapid rates? Sister Ya?
So I am chopping at the bits here because it's too much that I want to comment on. But
okay,
first of all, let me give a shout out to a medical ethicist. Her name is Harriet Washington. She wrote a book called Medical Apartheid. She chronologizes the xenophobic and the malevolent behaviors of the healthcare system from far back as the 1600s to today. So when the sister said that we got a problem with the medical system, I think it was Dr. Steed, not just yesterday. This is historic. This is something that's traumatized us for centuries in this country, and we're not making it up. Tuskegee is the one that you can remember because of the nice movies and all of that's been put out of it. But actually, the polio vaccine was made out of a very unethical process from Henrietta Lacks. It's called the HeLa cells. And they used her cells to make the polio vaccine, and they didn't give her any type of consent. They didn't give her any insight, and they darn sure didn't give her no money. And that vaccine actually still exists to this day, and AstraZeneca and others are making vials of it without paying her family anything. So the ethics of this has not gone away. Then you're going to turn around and ask me to take a vaccine that, let me be clear, it is the most newest type of technology ever been on this planet. This vaccine is actually not a real vaccine the way you think of it. This is using CRISPR. I think Dr. McNally mentioned this earlier about the RNA aspect of this. This vaccine is a CRISPR. CRISPR uses an RNA approach to changing your DNA so that you could recognize something down the line. That only happens in sickle cell and cancer patients. This hasn't been the most widely used approach to this, but this is what this vaccine coming from Pfizer and Moderna, they are using an RNA approach. That is the latest research out. Most of us don't even know what CRISPR is, let alone what type of vaccine this is going to be. So I'm going to err on the cautiousness that we may not should be. I feel that diversity is something that we need in anything we do. I don't care if it's from taxes to housing to whatever. Always diversity. But I'm also going to say for this vaccine, we need to be more careful about who's the ingredients that's in it or how they're using it, who's running it, where are any Black pharmaceutical companies, where are some Black entrepreneurs that can benefit from this the same way the whites do. And more importantly, why a vaccine and not treatment? I'm still questioning that, because treatment means to help our bodies, we need to do things like vitamin C. We need to do immune building processes that we don't do as Black people because we're too darn stressed from it. So we're going to have to, we don't do it enough. We don't do it. Like she said, her pot liquor, honey, I know you were talking about some greens and you was trying to mix it in with some, I remember that too. But the thing is we don't go, that's grandma's hands, that's big mama hands. You know, she used to pour that castor oil down your throat just because you felt some kind of way. The point of it is that we're not, y'all laugh because y'all remember that. The point of it is that we're not doing enough to build our immune systems and especially as Black people, because we're so busy taking all those other drugs and
Okay,
other
so
substances that's been given to us that has weighed us down for our other ailments that we don't talk about.
Dr. McNally, you were shaking your head a little bit.
Yeah, I just want
Sorry.
to jump in and correct. This is not CRISPR. So CRISPR is actually what's called gene editing. That's when somebody is doing something that goes in and changes your genes. That's what CRISPR is. Sister Ya is correct. This is a different kind of vaccine than we've seen before, but it's not CRISPR. What it is it's a little piece of RNA that they're actually giving you. It goes in, it makes the protein that will help your immune system recognize, but then it disappears. So that's what's so different about this type of vaccine is it's a very short-lived type of exposure. And people think this will be the way we do vaccines in the future, but it isn't going in and changing anybody's genes. So I just want to be clear about that part.
And I will be just as clear, Dr. McNally. What I will do is find my source, because it was just on Empire & Company with the doctor that just said it, and he used the term, we are using the CRISPR approach for this vaccine. So if he's wrong, I will definitely let you know, but I will get you the source, because that is what he said, not what y'all said.
Yeah,
but
well,
I will find the source.
I am actually an expert in this area. I guarantee you it is not gene editing.
One of the things I do appreciate that is being touched on is our immune systems. I think that in the information I've been seeking in the marketplace, a lot of the Asian cultures, where again my son lived for many years, a lot of the African cultures, and what used to be authentic, real soul food back in the day, not this hot fried garbage now. But we used to have more root vegetables, more pot liquors. We used to have a stronger immune systems because our women in the churches, the prayer circles, people would visit people and bring pots of vegetables to help part of the healing. So all of the healing and nutrients were built into our culture. And now we've lost a lot of that. And we're just counting on a system that is never delivered for us. And I think to ask that system to deliver for us now, when it's not even delivering for its own mainstream America, is something we ought to just build some extra. We need to build some extra strategies in that. And I'm actually working on looking at some of the things that are happening in Africa, aside from the fact that they're prepared because they've had so many viruses in the past. You know, they're like been here, done this, and so they have a lot of better behaviors. But I still think that the other cultures have stronger immune systems because they have better diets, less processed foods, less genetically modified fruits and vegetables. Lots of things like that have to be kind of put back into the mix of our culture.
I kind of want to wrap things up. What I'm hoping our audience takes away from this is that, you know, like we can meet at a happy medium. Of course, there's like holistic approaches, but at the same time, there has been advances in science. I mean, we're not living in the ages where I can get a cut on my hand and then all of a sudden like die from some kind of disease where I could have just got a tetanus shot. You know what I mean? Like we need to strike some sort of balance. And I think one thing that as a media professional I can do is just be very careful about the messaging that I put out, because I think when this virus first came out, there was a lot of messaging of like, oh, this only affects old people for real. So I think the young people, millennials and younger, took that and ran with it like, oh, I'm not going to die from it, so I don't really need to pay attention. And then there was a lot of messaging around like, actual public health officials were saying like, don't go buy up all the masks at the store. And it was really because there was a shortage of PPE, and it wasn't really based on the facts, you know, the knowledge that we know now, which is that masks do absolutely save lives. So I think when there are conflicting messages, it is very, very difficult to build that trust. So that's something that I want public health officials and, you know, the medical professionals to take away as well. Like, we have to be consistent, you know. So I want to give you all last words. Usually we have a lot of comments. I'm like, maybe our audience is just like listening today, but like, for people, whether they want to take the vaccine. Okay, so yeah, so people, social distancing is merely impossible. Any suggestions for people dealing with, this issue of social distancing during the winter, and just in general, ways that our communities in general can stay safe as we go into the winter? Please, let's start with Dr. Steed.
So, and that we're all grappling with this. So I think that we're really making it up as we go along. But I think that what's important is to really hear and heed the experts on this. So there's been many guidelines that have been published on it, and recommendations. Really keeping audiences and gatherings at a pure minimum, really isolated to those that actually live in your household, even if it's larger numbers of individuals. But when you're isolated to those individuals in your household, make sure that you practice wearing universal masks. Try to pay attention to the 6 feet rule. Really practice hand hygiene. And then using the various video outlets. So even I'm really learning through it. They have various mediums for video outlets to really engage with your loved ones, such as house party and Zoom parties and all kind of different outlets for socializing. But I think that the front and center perspective is there are guidelines out there by the experts who tested and tried this. I think the best efforts for all of us is to really heed those protocols, take those seriously, and all do our part to prevent the unnecessary spread of this pandemic that we all expect to come to an end very soon.
Thank you. Sister Ya, please, some parting words, how we can keep us safe. Hold on, we got you muted. Just 1 second.
Okay, there we go. So, yes, first of all, I want to thank everybody here that's, to be clear with you, we're here because we care. We're here because we want to put out the best of the dialogue. So thank you all so much from the tribe. I appreciate what you're doing here. And of course, I'm going to always be of service to you. Whenever Anthony calls, I'm going to try to make it work for you. But let me just say, one of the other things is Dr. Steele has already outlined to you all our universal precautions. You've heard it. Wash your hands, stay distant, wear the mask. You all heard that. Y'all could probably make a song out of it. In fact, the health
Sister, yeah, we've just been having some trouble reaching her today. Okay, lost her. Let's jump to Simone. Sister, yeah, hold on. Do we have? Okay, I don't know. Nurse Bryant.
Can you?
Okay, she's
I'll
back.
come back later. Well,
Okay.
Just HEPA-vax, if you can hear me, HEPA-vax. If you know what a HEPA-vac is, look it up, Google it. Have like 2 of them in your house and clean that's what they talk about, ventilation. They're doing that in a lot of buildings right now. And it's not 100% proof, but it's like anything else. Ventilation. You want to keep air coming and cleaning that air out. And that's what HEPA-vacs are good at. And the last thing, I cannot get into everything, but I want to just say to people, find a balance, stay engaged, do the research, watch some of it, but then sometimes turn this stuff off and go within. Go within. We need to have balance because, honey, ain't nothing outside of God, and this is happening. It's real. But those will survive. Those will be people who won't survive. I can't call that. But what I am going to do is say, if you find some balance and still your spirit and have the tenacity to want to live, I think those are also as equally as good as wearing a mask and washing your hands and doing the best you can with your immune system and build that way. Ashe and thank you if I go out again.
Nurse Brewer, please.
Thank you so much. It was an honor and a pleasure to be here. Just in general is what we educate patients and ourselves to do. There needs to be balance. How do you manage your stress? Practice hand washing. We have to wear our masks. That's very important. But this has highlighted the issues in healthcare and disparities in our minority communities. You know, the grocery store. People went out to buy toilet paper, but the vegetable aisle is, you know, full of stock. So we do have to find balance within our diet as well. And we have to work out, stay engaged, you know, running, walking, anything to help strengthen our immune system. So it's balance all the way around. And I encourage everybody with everything coming out to look into, you know, vaccines or treatments. There's still so much that we don't know, and there's research to be done, and there's research that already exists. So we need to educate ourselves so we can educate our communities as well.
Somebody said this, I had to pull it up because I'm just like, who don't want y'all to listen to Sister Ya? Because we invited her. So I hope you mean
yes, with open ear.
Maybe you mean the people in charge of the internet that's cutting out her connection. But I don't, you know, when I see comments like that, I have to highlight it because it's always like conspiracy. But like the media, we are trying to inform you. We're trying to bring people together. That's why we brought different opinions together. Dr. McNally, how can we stay safe? How can we learn more about your studies? Because there are going to be some people like, somebody's trying to prick me with something. I don't trust any needles. I don't know what's inside of there. Like, what do you say? What can hospitals do to really regain that trust? How can we learn about these studies that you're conducting?
Well, our study is available on the internet. It's scan.northwestern.edu if you want to learn about it. Nobody's poking you with anything. You get to decide whether you want to poke yourself with something. And that's how this works. We're very into empowerment, and people get to decide for themselves. In terms of how do we begin to repair, decades, if not centuries of mistrust, we have a long way to go. We just have to keep working at it because it's so important for everybody who's here. We've got to get through this. We're going to get through it together. And I just wanted to say one last thing, which is to say it's a true honor and a privilege that you invited me here today and to be with this esteemed panel of wonderful ladies, all so brilliant. I loved it. Just fantastic. So I wish everybody a good Thanksgiving and be safe and take care of yourselves, get good sleep, eat healthy, stuff like that makes a big difference towards keeping your mind right and keeping your body healthy.
Thank you so much. And Dr. Steed and Dr. McNally, I want to keep in touch with you all because at TRiiBE, we are looking into COVID research. We want to know what's going on at the hospitals and also just like the differences in treatments between hospitals and what's available. We didn't even get into that today, but we're going to go there. So we want to know. Angie, Miss Ford, like,
I feel like let me say I respect modern medicine. I don't want to come off like the one who. It's funny you mentioned the tetanus shot because my great uncle, they didn't give colored boys tetanus shot, and he stepped on a nail and died about 100 years ago. Wow. So there is progress, but it's at a glacier pace. What I would encourage everybody to, of course, follow modern medicine. I've had the surgeries, I've done the things, and I'm going to take the vaccine when it swings my way. But I would say take naturopathy seriously and take homeopathy seriously. You just got to incorporate more root vegetables in your diets. I mean, if we've survived thousands of years of mankind, these last 100 years of Western pills aren't the be-all, catch-all of everything. And let's just pay respect to our ancestors who ate better, did better, breathed better, worked harder. And let's give that some credit too. I don't want to come off like, uncivilized.
We're not judging you. We're not. This is a
listen. I know but I just got to get that in. Everybody needs some pot liquor. We got to get that back on the table. That is something we lost, and that is a failing. We have let the children down. Pot liquor.
I got you, because I definitely don't know anything about it. So my parents, if they're watching, y'all let me down.
Listen, but Sister, you heard me. You know the pot liquor's got all the answer. And the last thing is, most cultures have the herb pot on their stove. So like if you're Vietnamese, you have pho. There are other cultures. Everybody has the vegetables on the stove. America let that go for the drive-through number 4. We got to put that stuff back into our basic system.
I just want to remark that I support the pot liquor theory, and I very much practice.
Thank you. Okay.
We have one final question that came in. I don't want to leave without answering it, but people seem to be very concerned with the idea of a vaccine mandate. Like if COVID is something like the flu that like returns, can we be forced to take this vaccine? So Dr. C, you're saying no.
Yeah. So we can't take away from freedom of choice, and that is a basic principle of patient rights. So we cannot force or mandate this on a patient population. And as I noted, in healthcare, being on the front lines of this, and I always like to say I'm a recovering emergency department nurse. We're always first in taking vaccinations and things of that nature. And as a healthcare provider, absolutely we'll put the necessary mandates as possible as we roll this out to the frontline caregivers and employees in the workforce. But most certainly, when we're talking about public distribution on this, we can't force the public to do what is against their own basic free will. What we can do is continue to educate and continue to encourage the positives, and we need to get to a certain threshold in order to build up that overall immunity level as a community to prevent the further spread. So that is what we need to push.
But the international airlines are going to start mandating that there's a vaccine before you can travel. Are you guys aware of that? Because
that's what I was going to ask about. So you're saying like employers can mandate it, right? And then so there can be travel restrictions. Like if you go to certain parts of South America, you may have to take some shots. If you go to some parts of, like Africa, you may have to take some shots nowadays. Can they, like, who can put those mandates?
I would say travel is one of those areas. So if you're have certain restrictions on travel, I would believe that would be one of those avenues. So again, in those that are on the forefront of this, I think you can mandate it in those practices.
Yes.
Just the community at large. I don't think that you can govern mandating against this.
And the military,
there's always going to be some conditionings around what you get in public health. And the point is to try to be better for the greater good of most. But there's always exemptions. There's always people like myself who has refused, even as a healthcare worker. I'm able to not take the flu shot because you can't tell me the ingredients. I'm a vegetarian, it has eggs in it, and I can't be made to take something that's allergic to me. So there are always going to be some exemptions, and there's always going to be some ways to talk about it, and even travel to different countries. Some, like the shot for malaria, you won't be able to get out of that. So some things are going to be, you're going to have to just go with it. But what we're hoping is that as these vaccines matriculate, they do get better. And I don't want people to think that science doesn't get better. It does. But you have to make the decision of where you lie on the better. And so if it's for the greater good, you may have to take it. But on some occasions, you may not want to do that, and you don't go there or you find another way.
Right. So it looks like the medical profession is hoping that enough people take the virus so that it slows the spread, of the virus so we can contain it, you know. And then for those of you who are just like, absolutely not, it may not be necessary for you to take it because the virus will have run its course, you know. Right? Is that kind of, am I kind of getting there?
Yeah, I think that we have to be at a certain level of maturity with
Okay.
it, because you know there are individuals who are naturally fearful for good reason, right? So that fear is just not happening overnight, and is not for just any reason. So if you mandate the vaccination, we need to make for certain that the risks, the side effects, the effectiveness of the vaccination, we need to ensure that we go through all those various steps. Just because we don't want to be on the other side of forcing a particular agenda, and that causing more devastation than what we're dealing with right now.
Should parents be expecting schools to mandate a COVID vaccine for children?
Well, in today's world, there's already mandatory vaccinations in schools, so I can see it progressing in that way. But I'm interested in what my fellow colleagues here think about that.
Well, it's actually a bit of an issue right now because none of the vaccines are actually being tested in children. So that's a much bigger issue, which is we have no data about how this works in children. So it's not even clear that children, let's put it this way, when and which vaccine children might get has not been determined. They are not going to be in the first group of people that get vaccine.
That is crucial information and good to know. Okay, thank you all so much for answering our questions. I'm so grateful that you took the time to be with us today. To our TRiiBE family, I hope you got something out of this. I hope you revisit this video and take these little nuggets of information and continue to do research. Again, you know, you want to take information from multiple sources. We're not trying to tell you what to do, but we want you to be informed. So thank you all for joining us today. Again, thank you to the Field Foundation for funding this initiative, TRiiBE Tuesday, our monthly panel and discussion series. We do this every month, y'all. We won't be doing it in December, though. We're taking some time off. So we will see you in 2021, God willing. Thank you so much, everyone. Have a great night and happy holidays.